Here is our path. I will first clarify the terminology about artificial intelligence and large language model families. Then I will talk about medical case generation, multiple choice question generation, custom GPTs, script concordance tests, and I will conclude with key points. After that, I will show a small demonstration on how to use these chatbots. Okay. This is a ChatGPT generated question. After this session and the demonstrations, you will be able to generate questions like this on your own. Let's start with terminology. The broadest term is artificial intelligence, and machine learning is a subset of artificial intelligence, and deep learning is a subset of machine learning, and large language models and natural language processing is a subset of deep learning. Here you see the ChatGPT's main page. Yes, we are familiar with ChatGPT, but there are some other language models as well. Actually, ChatGPT is not a large language model. GPT is a large language model, but ChatGPT is a variant of GPT. There are some other large language model families other than OpenAI's GPT. For example, Anthropic's Cloud, they left OpenAI a few years ago and established their own large language model, and Gemini, which is from Google. And these three large language models are closed source models. But there are some open source models like Llama from Meta Facebook. It is open source, and Mistral branch-based large language model. And these are open source models, and there are some other open source models as well. Why open source models are important? Because just yesterday, ChatGPT and Cloud was not accessible because their servers were down and people couldn't use these products. Open source models allows you to download the model to your computer, then run it in your computer without needing any internet connection. So open source models are important. You see ChatGPT's main page, and here is Cloud's main page. It is another chatbot. And this is Hugging Chat, a platform that hosts open source models. So this is useful. I recommend you to use this as well. And I will show you in the demonstration. And here is a ranking that shows the capability of the models. This is based on human evaluation, a general evaluation. And you see that GPT-4o is the most capable model now, but it is a dynamic list, and you can check anytime that which one is the most capable model in the current time. So let's focus on ChatGPT. ChatGPT has been released publicly in November 2022 as a variant of GPT 3.5. And we used ChatGPT in January 2023 to conduct a study by generating medical cases and multiple choice questions. After that, GPT-4 has been released in March 2023. Then the latest one is GPT-4o Omni, has been released May 2024. This is our research that I mentioned. In this study, we generated clinical vignettes using ChatGPT and multiple choice questions. First, I will focus on clinical vignettes part. In this study, we randomly assigned medical students to two groups. One group received ChatGPT-generated medical cases, and the other group, control group, received human written cases, expert written cases. And they used these cases to search on PubMed and extract some evidence and present it in front of people. After the training, they evaluated the cases using some metrics. They were blind to the origin of the cases. They didn't know that which one is ChatGPT generated and which one is human written. And the assessment showed that the quality of the vignettes are comparable to those created by humans. There was no significant difference between ChatGPT-generated cases and human-written cases. Yes, we generated cases, but how? By using prompts. If we go very basic, prompt means that description of what you want AI to do. Here is the template that we use. You can fill this template using a disease or problem and the number of sentences. Then you paste it into ChatGPT or other large language model chatbots, and then it generates a case for you. You can see the examples here that we used in the study. You see at the left-hand side, the human written case. It's on group, and it consists of 3 sentences. And in the middle, you see the prompt we used in ChatGPT. As you can see, we asked it to generate a case on group, and it should consist of 3 sentences. And you see at the right-hand side, the case generated by ChatGPT. It includes 3 sentences, it's on group, and it includes a dilemma for students to work on it. Another study from another research group using artificial intelligence to generate medical case vignettes, although they did not evaluate the vignettes quality formally, this is a valuable research. You can see the content, and all of them has been created by using AI. You see personal identifying information, medical history, all the things, even physical examination, and some pictures as well. They used AI to generate these pictures, and these cards have been generated by using AI. Let's go back our study. Yes, we generated clinical vignettes, but we also generated multiple choice questions in this study. And our prompt was write a single best answer multiple choice question with 5 options. It should be on databases for evidence-based medicine. This is not a good prompt. This is a bad example of the prompts because, as you can see, the output is very superficial. You see that it targets lower level of cognitive skills like remember, but as medical educators, we should target higher order levels like clinical reasoning. So if this prompt is bad, it is not a good prompt. Why did we use this prompt? It is because it was in the early months of ChatGPT. Prompt engineering information was not common, so we used this bad prompt. Another study used another not good prompt, which is write 4 multiple choice questions with 4 answers and explanations for the incorrect and correct answers. If you use this kind of prompts, the output will be very superficial and not useful. And they interpreted this finding as ChatGPT fails to write appropriate multiple choice questions. But that's not true because the prompt failed to write appropriate multiple choice questions. And I wrote a letter to the journal by pointing out that it is not ChatGPT's ability. It is prompt quality. If you use very simple, very superficial prompts, you end up with not useful outputs. I would like to express my thanks to the authors because of their pioneering study and especially because they responded me very maturely. So I would like to thank them. So as we can understand clearly, prompt is important. Bad prompt brings bad output. And expectations are also important because ChatGPT outputs and the other large language models, chatbots outputs aren't ready to go without review with the current capabilities. Yes, GPT-4 and 4.0 are way better than 3.5, but we cannot go without review because there are some problems. What are these problems? Because all large language models hallucinate, and care must be taken to review output for correctness for users in domains like medicine because truthfulness and accuracy are required. They are hallucinates, they provide incorrect information, so we should check before using them. This is my study that I presented a good prompt in Spanish Journal of Medical Education, and this is the question that we generated using that prompt. And the prompt is here. As you can see, it is very detailed, it is well designed, it describes what a multiple choice question should include. And all you need to do, yes, the prompt can be improved, still improved, but basically all you need to do is you should add a topic, a learning objective, or a disease to the relevant part, and a difficulty level that you choose. Then it generates a multiple choice question for you. There is another good prompt in the literature, and they say, write a multiple choice question in NBME format. NBME, as you know, National Board of Medical Examiners. As large language models have been trained using the available knowledge in the internet, ChatGPT and other models knows what NVMe format is. So if you simply call NVMe format, it can understand what it is, and it generates useful case-based multiple choice questions. So currently, we have two good prompts. One is this one, and the other is this one. In another study that we conducted in Ankara, Turkey, we generated 10 case-based multiple choice questions using this detailed prompt. And after an expert panel, two of these multiple choice questions were incorporated into an exam without making any changes in the questions. The exam consisted of 25 questions. 23 of them were expert written, human written, and 2 of them were ChatGPT generated. And we investigated in our study the psychometric properties of these multiple choice questions. And we found that the questions can effectively differentiate between students who perform at high and low levels. It means that the discrimination levels of the questions are very good because the threshold for high stakes exams is 0.30. If it is above 0.30, it means it discriminates the students well. So as you can see, the discrimination levels are very good. But there were some problems as well. Like, as you can see, question number 3, the response percentages in answer options in A, in D and E, you see that the students chose these options less than 5%. It means these options are not functional. We call it non-functional options. So this is a problem. But if you are able to generate a question like this is a ChatGPT generated question, and we used this in our study. If you can generate this in a few seconds by typing a disease name and then hitting the enter key, it is remarkable. And if you tell someone that you are able to do this from 20 years ago or 10 years ago, they would tell you that this must be a joke. This is impossible. But with large language models, we humans are able to generate these questions in a few seconds. So as medical educators, we should use this kind of tools because it improves the multiple choice question quality, and it saves a lot of time. Yes, we told that the prompts are important and we should use good prompts. And this is one of the examples for good prompts. But it is still effortful to use this prompt because every time you want to generate a multiple choice question, you have to copy all this text and then you need to paste it, and then this is an effortful process. To make it easier, we benefited from a new feature of ChatGPT, which is custom GPTs. In custom GPTs, even non-programmers, even if you don't know how to code, you can create and share your own GPTs specific for your purpose. For example, you can create administrative assistants, online tutors, and some virtual patients, and anything that you can dream. And you don't need to know how to code. This is GPT's main page. By searching in the GPTs, you can access maybe hundreds or maybe millions of GPTs that people developed. And by using this powerful tool, we developed case-based MCQ generator. In this tool, if you use this tool, you don't need to copy and paste all the prompts. All you need to do is select one of the conversation starters here. One is my prompt, the detailed prompt. The other one is Zuckerman and colleagues prompt, which helps us to generate NBME style questions. You choose one of them, and then you enter a disease, a learning objective, or something like that. And then it generates a multiple choice question for you. And this is completely free. There was a paywall imposed by OpenAI, the owner of ChatGPT, but they removed this paywall last week, which is very good. And you can now access this page and you can generate questions without any fee. It is totally free. And here our other research, our article, and in this study, we described how and why we developed the case-based MCQ generator. So if you wonder about the details, you can access this. Yes, we told that it is possible to generate MCQs, but there is more other tools to assess clinical reasoning. But we thought that it would be awesome if we generate script concordance tests using ChatGPT. It is valuable because it assesses the ability to interpret medical information under conditions of uncertainty. It is a different method. Here is an example for script concordance test item. Simply, there is a brief clinical vignette, as you can see here. A 58-year-old woman presents to an emergency department with a 2-week history of intermittent vertigo. She feels well between episodes. In an SCT item, it asks you 3 questions separate from each other. For example, if you were thinking of benign paroxysmal positional vertigo, find episodes of vertigo last 30 minutes. So this diagnosis becomes less appropriate or more appropriate. The student choose one of these 5 options and submit. After that, we compare the answers, students' answers, with expert panel's answers, the experts' answers. So this is an SCT item that has been developed by humans. We thought that it would be awesome if we generate it using ChatGPT, and here is an unsuccessful attempt. We typed that, write a script concordance test item on appendicitis, and it ended up with not useful and meaningless for us. It is meaningless output because it tried to write a script for a movie with some questions. It is strange because it don't know what script concordance test is, and our prompt is very, very simple and lack of context. So we came up with a new prompt, and it has been published in here. And this is our prompt. As you can see, it is very detailed. It describes what an SCT item should have, and it allows you to customize the content. For example, if you want to generate a question for undergraduate medical students, you type undergraduate medical students or continued medical education participants, or if you want to be more specific, last year radiology residents in Spain, whatever you want. And you can determine the set of questions should focus on. For example, it can be on diagnosis, investigation, treatment. And at the end, at the bottom, you see you need to type a clinical problem or topic or learning objective. Then it generates a question, a CT question for you. And you can add a guideline or you write its name to benefit from. So it is very flexible and customizable prompt. And here is an SCT item generated by ChatGPT-4. As you can see, our attempt in the previous one was not successful because of this very simple prompt. And now, by using this detailed prompt, we were able to generate this question. As you can see, there is a brief clinical vignette. A 45-year-old male presents with sudden onset of right upper quadrant pain, worsening over the last 6 hours. He has no history of similar symptoms. And if you were thinking of this is acute cholecystitis, then you found that the patient's ultrasound shows gallstones with gallbladder wall thickening, and it becomes what? Actually, ChatGPT provided the answer as well, but when we provide this to students, we will remove the answer and we will provide the 5 Likert scale that is between -2 and +2. So it is very useful prompt. As I told before, it is difficult to copy and paste these long prompts every time. You can use this script concordance test generator. If you use this tool, you don't need to copy and paste it. You just enter the disease, the learning objective, the target group, then it generates an SCT. So it makes it more easy. So I will conclude my presentation with key points. The first key point is ChatGPT for sure and other large language model chatbots are able to generate useful MCQs and SCTs if we benefit from well-designed prompts. If you use prompts like that we used in our first study, it will generate very unuseful questions. And the second one is we should always be cautious when using the outputs of ChatGPT and other large language model chatbots because they are hallucinating. They provide sometimes inaccurate information. So review before using. And my last key point is follow the Flamingo for more updates. I have a YouTube channel that I post one medical education video per month. And I have X, formerly Twitter account that I post one tweet per day for medical educators and students. So feel free to follow these sources for more updates. And here is my email address. If you please do not hesitate to contact with me for any reason. You are more than welcome. If you use this prompt, you have to copy and paste like this. You add here a disease, a learning objective, or something like that. For example, yeah, let's write it here, and let's write it easy. But these difficulty levels do not represent the actual difficulty, but so please be cautious when using that. And it writes a multiple choice question for us here. This is ChatGPT 4o, the latest model, and it provides the explanation of the question and the answers. Yes, and as you can see, we are not confined with, we are not limited with just ChatGPT. Cloud is another tool that you can use, and it generates question. It will generate question, and it works in other large language models. As you can see, it generated a question, an explanation. And I mentioned open source models. This is Hugging Chat, a platform for open source models. You can choose these, all of these are open source models, but let's use Meta's Llama model, open source model, and you can generate question using this one as well. And if you don't want to use copy and paste the prompt over and over again and again, because it is effortful, you can access chatgpt.com/gpts. It is free without any payment. If you type here MCQ, you will see a Flamingo, and it is case-based MCQ generator. Let's start a chat. Let's use my prompt. I clicked here, and it will ask us what disease, what learning objective, or what topic do you want, and what should be the question, the difficulty level. Let's write acute appendicitis and difficult. And here it generates a question. So it is easier than copying and pasting the prompt. So you can use it. And this is my demonstration, so I can stop sharing. Let's start a new chat. I can use the NVMe style format. I clicked the Zuckerman, and now it asked me to add a disease, like, and it generates based on the other prompt, the NVMe style prompt. So you can use both of them. Both of them are useful. So you don't need to copy and paste the prompt. You just add a disease, so it generates.